This programme is the first of its kind for rare cancer to facilitate service improvement, and we're really listening to the lived experiences of patients and carers, which result in us using those insights to develop services which meet their needs.
Having a brain tumour or central nervous system tumour or cancer is really complicated and very complex and is life-changing for patients.
Some people have poor prognosis with this cancer, and it affects everything about who they are as an individual. So the rarity and the complexity of the cancer in itself, on its own, is what is unique about this piece of work. Then layered on top of that is then the complexity, I think, of the geography of the programme. Some people can travel up to 60 miles one way to get their treatment. So for me, it's about the numbers involved in terms of the number of local authorities, commissioning groups, NHS organisations, that makes it quite a difficult task to navigate our way around. And if it's difficult for us, how difficult it is for patients.
One of the things that is really key is that we can have ideas, but actually if we don't check those out with the patients and the carers, then we might be developing a service that doesn't meet their needs. And so we talked to the patients, we interviewed the patients, and we said, what do you think would make things better for you in making it easier to access the service, to get information? And so that sort of specifically has helped to co-create what we're doing. Because before we started the programme, we had anecdotal information. The clinical teams were concerned about some of the things that they felt that they would like to improve.
We've got some expert teams, and we need to draw on that learning, we need to draw on that expertise and share that.
I think the really exciting thing about this programme of work is that it takes the time to talk to the health professionals, to actually look at what it is that they're doing, to listen to their stories, how challenging it is to deliver care for this patient group.
So we've got that real insight to help us then have that intelligent conversation about actually the services here that are needed for this patient group. How are we going to make that happen? Let's be clever about how we can make that happen. How do we nurture maybe services that are out there that need tweaking or looking at to maybe offer an extended service for this patient cohort? So my vision is that in an ideal world is that patients that have this cancer are able to get the service that they need in a timely way that makes sense for them at that moment in time.
And we can help to inform and raise the profile of this very important patient group. And I think that's a really exciting opportunity. We can learn, and we can learn what works well, and potentially can take that and put that in another area and help to develop services across other areas as well.
You know, I'm excited that there's so much more to go at and so much more to do, and the fact that we can do that working alongside the clinicians and the patients makes it a worthwhile journey, and hopefully we'll achieve big things.